Hello, hello, hello. Hi. This is Margaret. Hello. How is everyone doing? Um so I am here to talk about mental health. Mental health. I don't know how people look at it, but that is a topic that needs to be discussed. Um I don't know, but it's a lot going on, and I know people go through so much, and in a way, they are not able to explain themselves why they feel this way, why they think this way. I am here to make it clear. Once again, my name is Margaret, last name is Oduro. I'm a psych NP, board certified. I'm also adult nurse practitioner. So I hope this is going to be interesting for us to discuss or to talk about. Um, First of all, I just want to talk about depression. Depression. The word itself just explains what it is to be depressed, to be compressed, to be down, to be sad, to be restless, to be hopeless, fatigue, not being able to sleep, all the stuff, like feeling impossible. Okay. I I will say, like, we do have some environmental piece, and in a way also a genetic piece. But I would say the ones with the genetic piece are the ones who, no matter what you do, irrespective of therapy, irrespective of medication, they still go through the same thing. But depression is one of the side diagnoses that is very, very common. It's so common. Very common among children, common among women, common among the old elderly, is common across board, like among student, kids, children, everywhere. So how do we, like I already talked about the symptoms, like the things that you feel that will make you like feel that this is depression. You know, Depression with, what I said, it's not once in a while we can feel like, oh, I'm down, I'm sad, but in a situation whereby you feel very sad, restless for every day, every week, months, okay, more than 6 months, that's not normal. No, that's something that you really have to do a follow-up on. That means you need to talk to somebody. You need to talk to a therapist. You need to talk to a psychiatrist. You need something. So just in case you are in this category whereby you've been very sad, all that for more than 6 months, and you are not taking any medication, and you've not been able to consult with a therapist, I think this is something that, you need to listen to. So with those symptoms, right, what do you do? I would say the first thing to do is just to, contact, like, talk to a therapist. Let the therapist talk to you. Let's see what is going on. What is causing you to feel depressed? What is the brain behind this depression? Is it because of one particular thing? Is it because of so many things? Is it genetic? Is it your environment? What it is? So once we see what it is, or the genetic or the generation of what it is, once we see what it is, then we also have a solution, right? So normally I tell patients, I believe in therapy a lot. I do believe in therapy. I normally recommend therapy first, just because I've recommended patients to go for therapy, and after that they actually don't need medication. But in a situation whereby, you go through therapy and you instantly, like, even with therapy, with sessions and everything, you still feel the same way, and you cannot even overcome that feeling of depression, then I would say the next step for you to do is to talk to a psychiatrist. Who is a psychiatrist? A psychiatrist will be able to diagnose what depression is, be able to explain what the diagnosis, like the symptoms are, be able to do the evaluation, and be able to give you medication. You understand? So we have different medications, and I always tell patients, I said, listen, what will work for A will not work for B. What will work for B will not work for A. So it's just like a trial thing. Like some people, you just start medication and it works right there. Like you don't have to go back and forth. Others, you just have to go through different trials before getting to the level where the patient feels better. Those are the ones I consider like resistant depression. But we'll talk about that later. So, I mean, just say, for instance, you start medication is working, you feel better, you don't feel that resistant, you don't feel that fatigue, you don't feel that constant, multiple ideas going through your brain, resistant, like, restless, not being able to sleep. Yes, that means you are in a good position. Medication is working for you. Okay. You will always have people that, with even the medication, it's not going to work. Like nothing works. But that is another thing we can talk about on a different day. All right. You have the opportunity to ask questions during your intake session. You have opportunities to, talk about the things that you want to talk about. But I believe, depression, it's something that we really need to talk about. Just see depression as, another chronic medical condition like diabetes, high blood pressure, even cancer. Yes, because the brain is part of the body, and the brain is the most important, vital part of the body. Any little thing to the brain can cause so much. So I cherish the brain a lot, and, I believe that a person with a positive mental health will be able to also have a positive medical health. So you can take care of your medical health and just leave your mental health, because then, the body is not fully working. So honestly, I believe mental health is a big deal. And if you are someone who really goes through some of these things that I said, like, feeling hopeless, worthless, fatigue, difficulty sleeping, just all that, and this has been going on for months, you really need to talk to either a psychiatrist or a therapist. Like I said, I'm a psych NP. I have my own practice. The name of my practice is called Binnell Behavioral Health. It's located in Philadelphia, 7236 Elmwood Avenue. It's a small practice, but trust me, we do a lot. We try to identify diagnosis, treatment and everything. So if you are really interested, you can contact me on my number, the practice number 215-987-6141. All right. And also you can email me. It's Binnell Behavioral Health Services 72 at gmail.com. Sorry about that. I'm getting confused with my emails because I have different ones. But you can reach out to me. Like I said, phone number 215-987-6141 or email binnellbehaviorhealth.com. Just go to my website and then you will find all this information there. I'm open Monday through Friday, half day on Saturdays. Just reach out and then I'll really take good care of you. If you're, somebody going through that, there's so many things I can talk about. There is anxiety, there is ADHD, there is resistant depression, we have autism, all that stuff. We do take care of that. Just reach out and then we'll take it from there. All right. Thank you for just being my audience and listening to me. If you have any questions, just go to my website. Like I said, binnellbehaviorhealth.com. There's more information there. You can have all the necessary information you need to reach out to me and I will talk to you later. All right. Thank you. Bye bye.